Between remedies like Botox to prescription pills, migraine sufferers have spent millions, literally millions of dollars, trying to get rid of the intense and often debilitating pain.
Yeah, they will do anything to get some relief, but as WREG's Troy Washington reports, some patients are finding that relief in some unlikely cures.
Usually I would have to just lie in bed, just cover my eyes and just stay there until it would go away.
As scary as it sounds, Elizabeth Williams isn't talking about the boogeyman or things that go bump in the night. She's talking about a pain that millions can relate to.
You have this throbbing sensation in your temples and across, your forehead. It's really nothing you can do for it, but just wait until it's over.
It sounds drastic, but a massive migraine can leave you blind, even paralyzed until it passes. For Williams, the migraine started when she was just a teenager. As an adult, they caused her to miss work.
You really can't function. It's just that bad, because with me, my headaches would be so bad until I would have kind of like tunnel vision.
For years, she suffered in silence, getting by taking aspirin and using a cold compress to suppress the pain. That was until the doctor suggested sinus surgery.
I had the surgery, I guess, about in 89, 90, and I haven't had a migraine headache in years.
Relief finally for Williams after years of suffering. Migraines can strike all ages. For 12-year-old John Phoebus, the pain put a pause on his soccer action.
He's the youngest of 3 boys. They're very active. They all play soccer. They are all in scouting, church group. They don't sit around and do nothing. They're active boys. And he just was in the bed all day for 6 or 8 weeks at a time.
The prolonged migraine nightmare sent the family searching for relief.
We tried several different doctors, neurologists, infectious disease doctors, all sorts of blood tests, MRIs, spinal fluid tests.
Phoebus missed days of school and found himself in Cincinnati's Children's Hospital's migraine clinic.
They gave us the most potent medication that they can give, a series of 10 treatments over 3 days, and it didn't do anything for him.
At their wits' end, the Phoebus family turned to acupuncture.
99.9% of the time, acupuncture is the last thing they try here in Tennessee, because they'll go to their doctor, they'll do medication. Some of them went so far to do Botox and it still doesn't help. It's all a Band-Aid, it's temporary, but this is a permanent fix.
The Chinese method focuses on key points and believes you just have to poke the right place to get a response from the body.
Just like your car needs a tune-up occasionally, acupuncture is very similar in that. It's very important for the maintenance of health.
It's a science that dates back to ancient times. Amy Lee is a neurologist and 4th-generation acupuncturist. She says a migraine is actually a symptom of a deeper issue.
Pain medication or something just to silence that pain. That doesn't mean the problem's gone. It just means like you turned off the siren.
She says placing pins on a person's body can help tailor a plan to get to the root of the real problem. And the real problem is unique to each person, since every person's migraine isn't caused by the same thing.
Stress is a trigger, food often is trigger. Wine, all the injury, infection. People who tend to have migraine when they're sick, that's really when it comes out, because your system is not balanced or harmonized. Therefore, it's more likely for that symptom to come out.
She says don't fall for the fads out there either.
I do not recommend piercing for treatment of pain or medical conditions.
The gut-wrenching pain has sent people into piercing shops searching for relief through a cartilage piercing. But Dr. Lee says even that won't work.
It did work for me.
Q Richmond has had the piercing for over a year, and he says he notices a big difference. However, Dr. Lee says that relief won't last.
Over a long term, once that area scars over, now you've burned out the one resource that you could use to actually tap into to help that area.
Migraine misery can start in some unlikely places, like your mouth. Dr. Joseph Dove says jaw issues can leave you cringing.
Sometimes people have pain that radiates up the jaw to the temple or in front of the ear, or it may travel in the way my fingers travel here. The pain will travel and radiate.
Meaning that pesky pain could be related to a tooth, muscle, or joint problem that needs to be addressed with your dentist to stop the headaches. Both Williams and Phoebus have found their cure.
And I get better grades now, at least I can focus.
I thank God for my ENT specialist.
And they say keeping an open mind could help you solve your own migraine mystery. Reporting in Memphis, Troy Washington, WREG News Channel 3.
What a wide range of remedies there. Well, studies have also shown that certain yoga positions can relieve migraine pain.